Welcome to Medicare 101, Introduction to Medicare. By now, I expect that most of your mailboxes have been absolutely swamped by a tsunami of brochures from insurance companies encouraging you to sign up for their Medicare plan. The reason why your mailbox is swamped? Well, there's about 250 Medicare health insurance plans and 40 Medicare prescription drug plans available to you in Mesa and neighboring counties. And the insurance companies that offer those plans really want you on board. Our goal at SHIP is to help you navigate through this Medicare debris field to reach the best health and drug insurance solution for you. We're going to cover a lot of ground in the next hour, and when I did this class, I had as many questions as answers. So if this class also generates for you additional questions, please contact the Mesa County SHIP office at 970-243-9839 or at the email address shown on the slide to set up a one-on-one counseling appointment with a trained and certified SHIP Medicare navigator. You reach this Medicare 101 cruise through the Mesa County RSVP website. Mesa County RSVP works in partnership with about 60 local organizations to fill important volunteer needs by recruiting individuals 55 and over. The Mesa County SHIP SMP program is one of those organizations benefiting from RSVP. So if you're looking for volunteer opportunities in Mesa County, contact the RSVP volunteer manager and consider joining the more than 600 RSVP volunteers making valuable contributions to our wonderful valley. This Introduction to Medicare cruise is presented by the Mesa County SHIP SMP program. SHIP, which stands for the State Health Insurance Assistance Program, and SMP, which stands for the Senior Medicare Patrol, provide free, personalized, and unbiased counseling and education on Medicare and Medicare-related issues. SHIP launched nationally in 1990 when Congress found that the Medicare program had mushroomed to a very large and very complicated behemoth. There was, and continues to be, no organization other than SHIP with trained and certified counselors tasked with giving you unbiased guidance on Medicare and Medicare-related issues. There are about 2,000 SHIP affiliates and 16,000 crew members sailing from different ports around the country. If you're not in this area, you can find the nearest ship to you through the national website or the 800 number shown on this slide. Our Mesa County SHIP launched into the murky Medicare waters in 2008. Our ship sails with one RSVP staff member and 8 trained and certified volunteers. Last year, we counseled and educated more than 2,500 clients. You can contact the Mesa County SHIP by email or telephone for counseling appointments and class schedules. You can also go to the Medicare Assistance tab on the Mesa County RSVP website to find out about other Medicare presentations and Medicare information documents. Today, your Mesa County SHIP is sailing out of the Introduction to Medicare home port. However, SHIP sails out of other Medicare and Medicare-related ports important to you once you are on road into Medicare. Our most frequent cruises originate from the Prescription Drug Plan Review port. From October 15th to December 7th each year, a period called Annual Open Enrollment, Medicare encourages you to review and change your prescription drug coverage. Last year, Mesa County SHIP saw 1,300 clients during this 7-week period. More than half of those clients saved money on their prescription drugs with the drug plan review, and the savings totaled $525,000 over the coming year. So I encourage you to reboard SHIP during annual open enrollment with a good chance to save money on your meds. Another time to reboard SHIP is when your circumstances change. Medicare has a special enrollment period when you move to another area or move to a nursing home or one of your insurance plan ends or you lose Medicaid or extra health benefits. So contact SHIP when one of these circumstances changed to see what your options are. Medicare, medical care and prescription drugs are expensive even with the best choices for Medicare health and drug insurance. SHIP helps clients apply to state and federal financial assistance programs and to identify other programs that might mitigate the expenses of medical care and prescription drugs. Finally, when you start receiving Medicare billing statements, you might wonder how they could possibly be more complicated. If you are ever confused about a bill or suspect an error or fraud in one of the charges, please contact the Mesa County SHIP for help. The Mesa County SHIP is a nonprofit that sails in part because of federal grants and in part because of donations from local agencies and individuals like you. Each year we save clients hundreds of thousands of dollars as they are getting into Medicare and also while they are on Medicare. If you find our SHIP services to be valuable to you, please keep this Mesa County SHIP afloat by sending a check to the address shown on the slide or pushing the donate button on this slide to contribute money to the SHIP program. Let's set sail on this cruise, Medicare 101, Introduction to Medicare, through the murky Medicare waters. By the time you disembark on this 1-hour cruise, you will know whether you need to enroll in Medicare, how and when to enroll, what Medicare covers, and how to protect yourself from Medicare errors and fraud. So settle into your deck chair and let's go cruising. The first port we visit during this cruise is, do you need to take Medicare? You may be eligible for insurances other than Medicare, which may allow you to delay enrolling in Medicare or not to need to enroll in Medicare at all. Medicare is divided into 3 parts: Original Medicare, secondary health insurance, which can pay for all or part of the medical expenses not covered by Original Medicare, and prescription drug plans like the Part D drug plan. These last 2 parts are the reason for your tsunami of mail. This is a long but very important slide. Let's go through each insurance option other than Medicare and indicate how it typically affects your decisions about Original Medicare and the other 2 parts. There can be exceptions to the general patterns discussed on this cruise. So I recommend that you contact a SHIP navigator or your HR department to confirm your decision about whether to take and when to take Medicare. Some of you may currently be working and covered by employer's insurance. If you and or your spouse are covered by your employer's health insurance, typically enroll in Original Medicare Part A, hospital and hospice insurance, when you're first eligible for Medicare if it is premium free. Keep your employer's insurance, although you are more than welcome to compare it with the Medicare options with the SHIP navigator and choose a better path for you. Typically delay getting Original Medicare Part B and other parts of Medicare until retirement. However, if your employer covers less than 20 employees, you will need to enroll in Original Medicare Part A and Part B when first eligible to avoid future delays and penalties from the federal government. You should check with your HR department to confirm that the employer's health insurance is credible, which means it is as good as Medicare. Only credible employer's insurance allows you to delay your decision on Medicare till your retirement. It is a very much different situation if you are retired and on either COBRA or employer's health insurance for retirees. If you are in these situations, you need to enroll in Original Medicare and consider secondary health and prescription drug insurance when you are first eligible for Medicare to avoid possible delays and penalties from the federal government. For you, stay on board for the rest of this cruise. If you're on Obamacare, you should enroll in Medicare when first eligible to avoid delays and penalties. You should also stay on board for the rest of the cruise. When one receives 24 disability payments from Social Security, that person becomes eligible for Medicare and needs to consider enrolling in Medicare to avoid possible delays and penalties. So also you should stay on the cruise. If you are on Medicaid, you will need to sign up for Original Medicare when first eligible. You may be able to continue to use Medicaid as your secondary health insurance. However, Medicaid income and asset limits change when you are on Medicare, so check with SHIP or your Medicaid agency to see if you might still qualify for Medicaid as a secondary insurance after enrolling in Medicare. Be aware if your Medicaid continues for you, you will need to enroll in a Medicare prescription drug plan because your Medicaid, when paired with Medicare, will no longer cover your medications. Now for you vets at the VA. The VA recommends you get Medicare because VA is not sure what the future holds for the VA. However, most vets are comfortable getting their medical care through the VA system and thus do not get Medicare, except for Part A if it's premium free. If you want access to both the VA and the Medicare medical systems, then consider signing up for Medicare when first eligible. Meds tend to be less expensive at the VA than through Medicare, so most vets will get their meds through the VA system, even if they sign up for Original Medicare and a secondary health policy. If you are on TRICARE and Medicare eligible, get Part A if premium free. If you are retired and on TRICARE for life, you must have Medicare Part A and Part B when you become eligible for Medicare. Your TRICARE for life insurance works very well as a secondary health and drug insurance plan. If you are a para employee and you and your spouse are covered by your para insurance, you can delay your enrollment on Medicare until you retire. However, if you are retired when you become eligible for Medicare, you need to enroll in Original Medicare Part B. Enroll in Medicare Part A only if the Part A is premium free. Paracare usually works best as a secondary insurance to Medicare, but it is good to compare the cost and benefit of Paracare as a secondary insurance to other Medicare options. Finally, if you're eligible for FEHB, Federal Employee Health Benefits, you should sign up for Part A when first eligible for Medicare if it is premium free. Most who are eligible for FEHB do not sign up for Medicare Part B because the cost of the monthly premium for Medicare Part B typically exceeds the reduced deductibles and copays if you should sign up for Medicare Part B. And most will use the FEHB insurance as secondary health and prescription drug coverage. Check with FEHB or a SHIP navigator if you believe you might benefit from Medicare Part B or Medicare prescription drug coverage. Okay, we have spent a long time in our first port. Do you need to take Medicare? But it is a very, very important port. Following the guidance in this first port will allow you to avoid delays and penalties imposed by Medicare and enroll in the best type of secondary health and prescription drug insurance for you. If you have any questions about the information presented in this first port, do not hesitate to set up an appointment with a SHIP navigator or with your HR department. So let's take a little break before the next port on this Medicare cruise. For those of you who decide you don't need Medicare or can delay your enrollment in Medicare due to employer's insurance, you're welcome to disembark at this point, but perhaps not in the way shown on the slide. Thanks for sailing with ship, and we hope to see you later. For the rest of us, do some yoga, grab a beverage, adult or otherwise, and hop back on board as we continue this Medicare 101 cruise. Welcome back on board as we embark for our next port, when to enroll in Medicare. When to enroll in Medicare. Medicare has established 7 types of enrollment periods for original Medicare, secondary health insurance, and prescription drug insurance. I'll focus on 3 of these: initial enrollment, annual open enrollment, and special enrollment, because they capture the majority of those enrolling in Medicare. If you fall outside these 3 enrollment periods, please contact a ship navigator to see if you may qualify for one of the other enrollment periods. Most people first become eligible to enroll in Medicare as they approach their 65th birthday. This period is called initial enrollment. If you enroll in original Medicare Part A and Part B, secondary health insurance, and prescription drug insurance during initial enrollment, you will not be subject to any Medicare delays and penalties. Initial enrollment spans the time period that includes the month you are born and 3 months before to 3 months after that birth month, unless your birthday is the first of the month, and then initial enrollment period moves up by 1 month. Confusing, right? If you enroll during the first 3 months of initial enrollment, Medicare will start on the first day of your birth month. Of course, unless your birthday is the first of the month, in which Medicare can start the first day of the month before your birth month. Oh, all those idiosyncrasies of Medicare just drive us crazy. If you enroll during initial enrollment, but in or after your birth month, your insurance coverage will start later and may result in a break in your insurance coverage, but no penalties as long as you stay within the initial enrollment period. A couple of groups become eligible for Medicare before their 65th birth month: those who are collecting Social Security disability payments, and those who are diagnosed with Lou Gehrig's disease or renal failure. Please contact Social Security or a ship navigator about your initial enrollment period if you are in any of these 3 populations. Missing your enrollment period may result in delays, penalties, or lesser insurance coverage. As we discussed earlier, those who are active employees or a spouse of an active employee and covered by credible employer's health insurance can delay Medicare decisions until a special enrollment period. This special enrollment period actually has different time frames for the 3 parts of Medicare: original Medicare, secondary health insurance, and prescription drug insurance. Didn't I tell you that Medicare was complicated? Sheesh. However, you will avoid delays and penalties if you enroll in all these 3 parts of Medicare: original Medicare, secondary health insurance, and prescription drug insurance, within the most restrictive special enrollment period, which is from 2 months before till 2 months after you or your spouse lose your employer's health insurance for active employees. If you should miss this most restrictive special enrollment period for any of the parts of Medicare, contact a ship navigator to see if you may fall within one of the other enrollment periods. Whew, I'm getting a little seasick on this Medicare cruise with the amount of information, exceptions, and idiosyncrasies in Medicare. Any chance that you are thinking about jumping overboard? Don't hesitate to contact a Mesa County Ship Navigator for more assistance. So now on to the next port, how to enroll in Original Medicare. Everyone enters Medicare through Original Medicare Parts A and B. Social Security is the agency that enrolls you in Original Medicare and collects your money for that insurance. If you already receive Social Security retirement benefits, Social Security disability benefits, or ALS disability benefits, Social Security will automatically enroll you in Medicare Parts A and B to start when you first become eligible for Medicare. You will receive your Medicare card about 3 months before you become eligible. The Medicare card is a thin piece of cardboard which will look like the dog ate it over a very short time. So I make a laminated copy of my Medicare card to carry with me and keep the original at home. Now that you've decided whether you need Medicare, and if you do need it, when to enroll and how to enroll, it's time to set sail for our next port. What exactly have you gotten yourself into, this federal program called Medicare? When you are enrolled in Medicare, you'll be sent a book entitled Medicare and You each year. The cover of this book is shown in the upper left corner of this slide. This book describes the features of Medicare and summarizes some of the recent changes to Medicare. For a more complete discussion of the recent changes to Medicare that may affect you, please take our Medicare 201 cruise, Current Medicare Changes, which is available through a link at this website. Medicare will change every year, so it's good to keep up to date on those changes. Medicare is individual medical and medication insurance. You and your spouse will each have Original Medicare Parts A and B, perhaps starting at different times if you become eligible at different times. You and your spouse may have different secondary health insurance and different prescription drug insurance plans based on each person's medical needs and budgets. Medicare will cover all medically necessary services to diagnose or treat an illness or injury. Later on, I will describe some services that Medicare does not consider medically necessary and thus will not cover. We're going to take 3 tours on this What is Medicare Island so you have an understanding of how the parts of Medicare fit together. So come over here for the first tour on Original Medicare. Original Medicare consists of 2 parts, Part A and Part B. Part A is often called the hospital benefit. Part A will cover expenses associated with inpatient hospital care and recovery, and hospice care. You will not be charged a monthly premium for Part A if you or your spouse has paid into Social Security and Medicare while working for at least 40 quarters. There are other ways to qualify for premium-free Part A coverage as well, but these are beyond the scope of this cruise. Original Medicare also has a Part B, which is often called the medical benefit. It covers a wide range of medical services like physician care, outpatient hospital treatment and recovery, durable medical equipment like insulin syringes and oxygen, ambulance services, and some prevention and screening tests that I will discuss later in this cruise. Unlike Part A, Original Medicare Part B is not free. The current Part B premium is $144.60 per month for most and payable to Social Security. You can pay this premium through a deduction from your Social Security retirement check, by sending a check quarterly to Social Security, or by setting up an automatic deduction from your bank account on your My SSA account. Let's move across the What is Medicare island for tour number 2, secondary health plans. This Medicare overview chart contains a lot of information and is designed to show how the pieces of Medicare fit together. We just finished our first tour, Original Medicare, in the upper left section of this chart. Original Medicare Part A and Part B will cover about 80% of the cost for medically necessary services. Both Part A and Part B have a deductible, which is a cost assessed to you at the start of a service for Part A, or for the first services each calendar year covered by Part B. Part A and Part B also have a set of co-pays and co-insurances that are assessed to you by Medicare for most medical services. When these deductibles, co-pays, and co-insurances are added up, Original Medicare will cover approximately 80% of your medical costs. Before we move on to Tour 2 on health insurance, secondary health insurance plans, note the two little help boxes on either side of the Original Medicare box. There are Social Security programs, Colorado Department of Health Services programs, and other financial assistance programs which may help to reduce the medical and medicine costs associated with Medicare. We go into financial assistance in more detail on our Medicare 102 cruise, accessible through a link at this website. You may qualify for one or more of these financial assistance programs if your gross income is less than $1,600 per month, $2,100 per month for a couple, and your assets are less than $15,000 or $29,000 for a couple. Assets will exclude your residence, its contents, and one vehicle per person. Contact a ship navigator if you think you might qualify for financial benefits. These general limits again are gross income of $1,600 per month for an individual, $2,100 a month as a couple, and assets of $15,000, $29,000 for a couple. So on to tour number 2, secondary health insurance plans. $1 million of medical bills in a year are not uncommon. In this case, Original Medicare Part A and Part B will pay approximately 80% or $800,000. That leaves $200,000 to be covered by you, a real budget breaker. There's no penalty assessed by Medicare if you do not get a secondary health insurance policy. However, because you have potentially high medical costs when you're covered just by Original Medicare, most will get a secondary health insurance policy to cover part of the remaining medical costs not covered by Original Medicare. Secondary insurance options are highlighted in the lower left section of this Medicare overview chart. About 1/3 of Medicare beneficiaries choose each of the secondary insurance types: a group insurance plan, a Medigap plan, and a Medicare Advantage plan. Group insurance options are offered by your current or former employer, provided because of your military service to our country or qualified under Medicaid. If you want to know more about these group options and how they work with Medicare, set up an appointment with a ship navigator or your HR department. Now to deal with that tsunami of mail coming through your mailbox and on your emails. Most of it deals with the two private insurance types of secondary health insurance shown on this Medicare overview chart. Medigap, also called Medicare Supplement Insurance, and Medicare Advantage, also called Part C insurance. Let's look more closely at these two options. So, while I heartily endorse, as your Medicare Cruise Director, the Medicare 102 Cruise, available through link on this website, listed on this slide are other resources that you might find valuable on secondary health insurance options. You can schedule a one-on-one counseling session with a Mesa County SHIP navigator. Contact the Mesa County SHIP by phone or email to set up an appointment to get free, personalized, and unbiased counseling. For those of you interested in learning more about Medigap plans, you can go to the two documents listed on this slide. The State of Colorado Department of Regulatory Agencies, or DORA, puts together a document on Medigap or Medicare supplement plans in Colorado. Our Mesa County SHIP has prepared a list of the least expensive Medigap plans for a 65-year-old non-smoker in our area, as well as some additional information on the companies offering those plans. These two documents, one from DORA and one from the Mesa County SHIP, are available through links on this website. For those of you interested in learning more about Medicare Advantage plans, go to the Plan Finder at medicare.gov. In addition, our office has prepared a summary of Medicare Advantage plan options in Mesa County. Both of these documents are available through links on this website. Finally, you can go to an insurance agent to learn about Medigap and Medicare Advantage plans. An insurance agent is the only one that can sell you a Medigap plan. An insurance agent can also sell you a Medicare Advantage plan, although you can also enroll yourself or with the assistance of a SHIP navigator on Plan Finder. I recommend that you do some homework, either taking the cruise or looking at one or more of the references listed above, before going to an insurance agent. Recognize that an insurance agent represents a fraction of the more than 250 health insurance plans available to you. Therefore, an insurance agent may not represent or sell the plan best for you. On this Medicare 101 introductory cruise, I'll discuss some of the basic differences between a Medigap plan and a Medicare Advantage plan, so you can focus on the best type of plan for you. Approximately 1/3 of Medicare beneficiaries will choose a secondary health insurance group plan, another third a Medigap plan, and the final third a Medicare Advantage plan. Medigap plans tend to provide easier access to medical services, while Medicare Advantage plans emphasize preventative benefits to reduce the possibility of needing those medical services. Who is best served by a Medigap plan? Because Medigap plans offer national coverage, they are better for snowbirds and frequent travelers. Those people may often be outside the provider network for a Medicare Advantage plan. Medigap plans tend to have wider specialist networks than Medicare Advantage plans because any provider that takes Medicare will accept your Medigap plan. Medigap plans tend to be less expensive for those with chronic illnesses because they have fewer deductibles and copays than Medicare Advantage plans. And because of those fewer deductibles and copays, Medigap medical bills are usually easier to understand and there is greater certainty of your medical costs. Finally, and most importantly, you are guaranteed enrollment in Medigap plan when you first get original Medicare Part B. After that, the insurance company can deny you a Medigap plan. So, if you wait until you have a chronic condition like diabetes, heart disease, or cancer to enroll in a Medigap plan after initial enrollment or special enrollment, the insurance company may find that you're an unreasonable risk and not allow you to enroll in a Medigap plan. So now for Medicare Advantage plans, which are great for general healthy people. Most Medicare Advantage plans have a $0 per month monthly premium, that does not change as you age. In contrast, Medigap plans generally have premiums over $100 per month, and they will increase as you age. Medicare Advantage plans have better preventative benefits than Medigap plans, such as payment of your health club dues and free routine dental, vision, and hearing exams. The goal of Medicare Advantage plans is to try to keep you healthy and away from needing medical services. So what is not to like about Medicare Advantage plans? Well, it can be more difficult and more expensive to get medical services with a Medicare Advantage plan than with a Medigap plan. First and foremost, you have to stay within the plan's provider network, and your provider must accept your Medicare Advantage plan, or you will face some daunting medical costs. Provider networks can be quite limited locally as well as nationally. For example, about half of the primary care physicians in this area do not accept any Medicare Advantage plan. So you must check whether your providers are in the Medicare Advantage network and will take your Medicare Advantage plan that you prefer before you sign up. Second, Medicare Advantage plans have more deductibles and co-pays than Medigap plans, so medical costs can be considerably higher for those with chronic or serious medical conditions. And remember, if you wait to apply for Medigap plan till you are sick and suffering from numerous chronic illnesses, an insurance company is likely to consider you too great a risk and deny you that Medigap plan. Finally, your primary care doctor must get prior approval from your Medicare Advantage plan for just about any medical service, except emergencies. Otherwise, the plan may consider the service not medically necessary and refuse to pay for it. How do you enroll in a Medigap or Medicare Advantage plan? You will go to an insurance agent, either local or national, that is registered to enroll you in Colorado, that represents the plan of your choice. SHIP counselors do not sell secondary health insurance plans. If you decide to enroll in a Medicare Advantage plan, you can also go to Medicare's Plan Finder, available through a link at this website, and enroll yourself or have a SHIP navigator assist you to enroll in the Medicare Advantage plan. We have addressed two parts of the Medicare suite on this What is Medicare Island: Tour 1, Original Medicare, and Tour 2, Secondary Health Plans. So now let's do Tour 3, Prescription Drug Insurance Plans. Back to this very full and heavily boxed Medicare overview chart. Sorry about that. Prescription drug coverage, the focus of Tour 3, is the third component of the Medicare suite. Choices are shown on the right side of this chart. Drug coverage can be available through your employer or military service. There are other choices for drug coverage through Medicare Advantage plans and freestanding Part D prescription drug plans. And note again that help box attached to the prescription drug coverage. There are federal, state, and nonprofit programs to reduce the cost of drug plans and drugs. The limits are generally the same as we discussed on the health side of Medicare. Incomes of $1,600 per month for an individual, $2,100 for a couple, and assets of $15,000 for an individual, $29,000 for a couple. If your income and assets are near or below those limits, please contact a SHIP navigator to see if you might qualify for a financial assistance program to reduce the cost of your drug plan and drug copays. Just like with secondary health insurance plans, there is no penalty imposed by Medicare if you do not get a prescription drug plan when you are first eligible. However, Medicare will impose a monthly penalty on your plan and limit the times when you can enroll in a plan if you decide to get one after your initial or special enrollment periods. A prescription drug plan through Medicare can greatly reduce the cost of medication, especially for brand drugs and less common generics. So for that reason, most Medicare beneficiaries will get prescription drug coverage during their initial or special enrollment period. Most Medicare Advantage plans and most group plans like Paracare, FEHB, TRICARE, and VA include prescription drug coverage. If you decide to get a Medigap secondary health insurance plan, or you are on Medicare and Medicaid, you'll want prescription drug coverage under Medicare through a freestanding prescription drug plan, also called a Part D prescription drug plan. Learn how to choose a Medicare drug plan that's best for you and how to enroll in one by taking our Medicare 102 cruise, Secondary Health Insurance and Drug Plans. You can sign up for prescription drug coverage through Medicare's Plan Finder, which is linked on this website. There you can determine the best freestanding Part D or Medicare Advantage drug plan for you and enroll yourself or have a SHIP navigator assist you to enroll. You can also go to an insurance agent to enroll in a Medicare prescription drug plan. The selection and enrollment process on Plan Finder is not particularly difficult. However, you may benefit from the assistance of a SHIP navigator, particularly the first time, who is aware of a few quirks in Plan Finder and can also determine whether some of your meds may be less expensive if obtained outside of a Medicare prescription drug plan. For example, through a pharmacy program, a discount card, or a patient assistance program from a drug manufacturer. Now, an important tip to save you some money in the future. Your medications can change from year to year. In addition, drug plans will change each year. Premiums change, drugs covered by the plan change, deductibles change, co-pays charged by the plan for medications you take will change. Put all this together, and there's a 60 to 70% chance that the drug plan you have this year will not be the best one for you next year. Medicare recognizes this situation and has an annual open enrollment period each year to review and change your drug plan if it is to your benefit. That period runs from October 15th to December 7th. Think Halloween, scary, I need to look at my drug plan again, and December 7th, Pearl Harbor Day. I'm sunk. I must stay with my current drug plan, which is more than likely too expensive for next year. Last year, our Mesa County SHIP did drug plan reviews for more than 1,300 clients. About 60% of those clients saved money because of that drug plan review, and the savings totaled $525,000. So run Medicare Plan Finder each fall with your updated list of meds and choice of pharmacy, or ask for SHIP assistance to help you run Medicare Plan Finder to save hundreds to thousands of dollars on your meds each year. Wow, that was a lengthy stay at that port. What is Medicare? 3 tours on what is Medicare Island. But I wanted to make sure that you understand the basic components of a Medicare suite and your choices within each component. When I went on Medicare, I attended Medicare 101 and Medicare 102, and then had 2 sessions with a SHIP navigator before I felt comfortable in my decision on a secondary health insurance plan and prescription drug plan. So don't hesitate to schedule 1 or more sessions with a SHIP navigator until you feel comfortable in your choice of a secondary health and drug insurance plan. A proper choice will save you tens to hundreds of thousands of dollars in medical and medication costs. One more reminder, see the buried treasure next to the first and third tours? That's to remind you that some of you may qualify for financial assistance programs through Social Security, Colorado Department of Human Services, or nonprofit organizations to reduce your medical and medication costs. When you come in for a counseling appointment or take the Medicare 102 cruise, we'll look for you to see if we can find you any of that buried treasure. So now on to the fifth port on our Medicare 101 introductory cruise. What original Medicare does not cover? Recall that original Medicare will cover all necessary medical services. It will also cover all FDA-approved medications for FDA-approved uses. So what does Medicare consider not necessary? The service most often not covered by Medicare, to the surprise of a patient, and the one that is most often the source of an appeal to Medicare for coverage, is an ambulance ride to the emergency room. Medicare will not pay for an ambulance ride if you use the ambulance as a taxi to the hospital. A typical ambulance ride around here is $800 to $1,000, well more than a taxi ride. I have seen Medicare deny claims for ambulance rides for patients with a broken pelvis or leg, for patients suffering from a pain suggesting a heart attack, even for patients who died in the hospital after being delivered by ambulance. So make sure that you believe that ambulance ride is medically necessary and not just a taxi ride in your mind before hopping in. Another service not covered by Medicare, to the surprise of many, is long-term care. About 40% of women and 20% of men will need long-term care beyond the benefits provided by Medicare for hospice, hospitalization, and recuperation. Why do more women need long-term care? I plan to stay out of trouble and let you fill in the blank there. You can get long-term coverage outside of Medicare through long-term care insurance or through Medicaid if your income and resources qualify you for that program. Non-Western or experimental procedures are not covered by Medicare. For example, original Medicare will not cover acupuncture except in the case of lower back pain. Check on your Medicare and U-Book to find other non-Western experimental procedures not covered. Original Medicare will not cover basic dental, vision, and hearing exams, and other services like dentures, glasses, and hearing aids, unless there is a medical condition associated with those. You may not be able to chew, see, or hear, but original Medicare is going to work darn hard to keep you alive. Remember that Medicare Advantage plans, unlike original Medicare, can provide some of these preventative benefits. Please take our Medicare 102 cruise to learn more about preventative benefits offered by Medicare Advantage plans. Other procedures like beauty enhancement, virility treatment, and chiropractic, although we may consider them necessary for the benefit of our marriage or quality of life, are typically not considered medically necessary by Medicare, and thus not covered by Medicare. Illegal or experimental medications are not covered by Medicare. The important one in our area is medical marijuana, which is not legal nationally, although legal in the state. Because it's not legal nationally, it's not covered by Medicare. On to our next port. Port number 6, preventative services. Original Medicare covers few preventative services. Its focus is to cover necessary medical services. As I discussed before, Medicare Advantage offers some preventative services like free health club dues and routine dental, vision, and hearing screenings. However, original Medicare does listen a little to my mother's warning that an ounce of prevention is worth a pound of cure. At least it'll listen a little bit. You can go to the Medicare website, medicare.gov, or look in the Medicare and You book sent to you each year by Medicare to find preventative services offered by Original Medicare and the frequencies they are covered. These preventative services include vaccines for flu, hepatitis, and pneumonia, screenings for colon, prostate, and breast cancer, counseling for diabetes, obesity, and some other medical and mental conditions. These services are free of charge for those with Medicare Part B if the provider accepts Medicare. If the provider finds some condition that needs to be treated after these preventative services, then those medical services will be covered by Medicare. Time to set sail for our final port on this Medicare cruise. Port number 7, Medicare fraud, error, and abuse. By the time you leave this port, you will be a full-fledged member of the Senior Medicare Patrol, or SMP. No badge, no uniform, and unfortunately no salary, but hopefully with a strong interest to detect and report Medicare fraud, error, and abuse. Previous studies indicate that 1 in 7 Medicare billings, or about 14%, are either fraud, error, or abuse. So you are likely to be a victim of Medicare fraud, error, or abuse during your time on Medicare. Error is most likely, but Medicare fraud and abuse also occur in our area. So if something doesn't sound right on TV or doesn't look right on your bill, there's a reasonable chance of Medicare fraud, error, or abuse. Medicare fraud, error, and abuse costs an estimated $55 billion of taxpayer money each year and puts our Medicare trust fund at risk. Fraud, error, and abuse mean higher premiums and less money available for Medicare benefits for you and for me. There are 3 steps to the prevention of Medicare fraud, error, and abuse: protect, detect, and report. First, protect yourself from Medicare fraud. For example, you need to carry your Medicare card with you, but consider crossing out a couple of numbers or letters that you can remember. That way, if you should lose your card, the thief will not have easy access to your Medicare number and bill your Medicare account. Also, do not provide your Medicare information or other sensitive information like your Social Security number to those saying they work for you or work for or represent Social Security or Medicare. Neither of these federal agencies will call you, email you, or come to your door unless you reach out to them first. Answering a phone call or email from a, quote, Medicare or Social Security representative may open you to identity theft. It's okay to be rude. Don't be polite to scammers. Second, detect Medicare fraud, error, and abuse. Keep a journal of your medical services and compare that record to your bills to identify any discrepancies. Check for items like services you didn't receive or double billing or services not ordered by your doctor. Each quarter, Medicare will send you a Medicare Summary Notice, or MSN, by snail mail or electronically on your My Medicare account that you've set up at the Medicare website, medicare.gov. As a member of the Senior Medicare Patrol, review these MSNs for fraud, error, and abuse. Errors are much more common and easily detected than fraud and abuse. I have clients whose medically necessary services were not covered by Medicare because the billing office put in the wrong billing code or Medicare number. For example, one of my clients was billed for a gynecological visit in Greeley despite being a male, despite living in Grand Junction, and despite, above all, being dead. The doctor's billing office had entered the wrong Medicare number, which caused his account to be charged. Medicare fraud and abuse are harder to detect, but they do occur in our area. I have one client who replied to a TV ad for a back brace, was asked to pay $1,800 for the exact brace that I bought him for $49 at Walmart, and was promised by the company that Medicare would reimburse him. Well, it didn't. Two other clients were charged $50 each time for an office to bill Medicare. Both of these situations, the back brace and the administrative charge, are examples of Medicare fraud. Third, report anything that looks suspicious. If something doesn't look right, if you just don't feel right about a billing, there's a good possibility that it's not right. As a senior Medicare patrol member, you need to report it. In most cases, it will be an error. The best way to report and correct an error is to call the provider and question the service or charge. Most times, they'll be corrected immediately. If you do not get a satisfactory answer from your provider, contact the Mesa County SHIP SMP program. Give us a call or email us at the Mesa County SHIP SMP program, and we can follow up on the issue. If it appears to be Medicare error, fraud, or abuse, and the provider does not provide a satisfactory answer, we will turn the case over to our SHIP attorney, who can pursue legal action. And now we set sail for our home port. Hopefully you will disembark with a much better understanding whether you need Medicare, when and how to enroll in Medicare, what are the different components of Medicare, how to select a secondary health insurance and prescription drug plan, what services Medicare covers as medically necessary, and which ones it does not, how to access Medicare's preventative services, and how to handle Medicare fraud, error, and abuse. Most people leave this Medicare 101 cruise a little seasick because of the large amount of information and choices to make. So after you recover, please don't hesitate to call or email a SHIP navigator to discuss any questions that you might have on your journey to make the best health and drug insurance decision for you. Bon voyage, and we at RSVP Mesa County SHIP program hope to see you again during annual open enrollment for a drug plan review, and perhaps on the Medicare 102 or other Medicare SHIP cruise.